Hello everyone, I'm Dr. Shammai Rockove from the Center for Men's and Women's Urology, and we're doing another segment of Ask Dr. Rockove. I want to thank you again for submitting all the questions. A common theme of a number of questions in the last few weeks have been regarding testicular self-examinations, or things that some guys have found as they were doing self-examinations. And the first thing I want to emphasize is the importance of just that. Women are encouraged to do breast examinations on some schedule, but not a lot of guys are educated in the fact that they are also supposed to do self-examinations of the testicle. One of the most common cancers that especially young men get is testicular cancer. And one of the most important ways of trying to identify it, if present early, is with a self-examination. The problem is that many young men are never told what to do and what to feel. So a couple of general suggestions. One is that the exam is best done in a shower or bathtub when you're relaxed and when the scrotum is relaxed. Gentle, gentle, gentle. And what you want to do, since there are two testicles, is to gently grasp the scrotum on each side and gently just take a very subtle feel of the entirety of each testicle. You're feeling for the contours. Abnormalities involve contour abnormalities. A normal testicle is almost like an egg, which is very smooth and very homogeneous. Homogeneous meaning that the entirety feels the same. If as you're feeling a testicle, you feel an area that's firm, a little irregular, a little raised, that should be something to raise suspicion, and that's something you need to get checked out. To try to be a little bit more graphic about this, I wrote out a little sketch of what the area may represent. So the testicle will sit within the scrotum, and it sits dependently, i.e. it sits down in the male genitals. Within the center of the structure, sperm are made, and then sperm are transported to the very top of the testicle to a group of structures called the epididymis. And it almost sits like a hat on the testicle. There is a normal junction and a normal change between this area and that area. And frequently guys will come in because as they're getting better at doing the self-examinations and distinguishing areas, they feel this separation, they feel that this and this are abnormal, and they get concerned. So what we do during that examination is, if we recognize that all that's being felt is this junction, we're reassuring. As a general rule, anything that happens in this area, or in this area, is not going to be dangerous. These are the areas that sperm get transported. They're very fine tubular structures, and oftentimes they get blocked and you can get cysts or outgrowths of it. Unless the area becomes uncomfortable or infected, there's really nothing that needs to be done about it. Most of the time we only know about it because we put guys through tests to determine that it's not in fact in the testicle. So if anything found on the outlines of the testicle in this area called the epididymis is abnormal, usually it may be abnormal but not dangerous. On the other hand, and very, very importantly, anything felt to be out of the norm within the testicle itself is always of concern to be dangerous. Again, as I said, this is homogeneous. It's supposed to be smooth in all areas. Any bumps, lumps, firmness, areas that are raised in this area absolutely needs to be evaluated, and best evaluated by a urologist. I would also argue, and my personal preference is that any man who feels something suspicious, even if the doctor does not think it's suspicious, I do think it's worthwhile following up with an ultrasound of the area. I've seen many people, even experts, make mistakes, and it's not worth making the mistake. So again, do the testicular self-examinations, do them at least once a month, and do it in a shower or bathtub. Get to know what your testicles and the scrotum feel like. And if you feel anything different than you have noticed in the past, get it checked out. What are we going to be looking for when you come in? We're going to look to see whether the area is within the testicle. That is always something that needs to be followed closely and evaluated, or whether it's coming from this area called the epididymis, which is almost never concerning. This is something better safe than sorry. If you think something's amiss, something's different, get it checked out. I'm Dr. Shammai Rockove from the Center for Men's and Women's Urology in Portland, Oregon.